Hello, everyone, and welcome to another episode of Beyond the Superficial. We are chiropractors and functional medicine practitioners at Synapse Center for Health and Healing, located in Eagan, Minnesota. Information shared in this podcast is not intended to diagnose or treat any medical conditions. Please consult with a primary care provider before engaging in any new activity or protocol. With that in mind, let's dive into this episode.
Welcome to another episode of Beyond the Superficial with the doctors at Synapse. Today we're going to be talking about estrogen dominance and what that means and just some myths about it, and also how to test for it and what we can do here at the office for it. And so, yeah, I'm glad that you joined in.
And I'm Dr. Ashley, functional medicine and chiropractor here.
I'm Dr. Ellie, a chiropractor and a pelvic floor therapist.
And I'm Dr. Amber Janetsky. I'm a chiropractor, functional medicine doctor, functional neurologist, and I do acupuncture here at the clinic as well.
Okay, so first up, what is estrogen dominance? Who wants to take it first?
I'll dive in. I think all of us are pretty passionate about this topic too. There is relative and absolute estrogen dominance. So we're going to dive into that today. Absolute estrogen dominance is when you actually do a serum test and you see that your estrogen is outside normal ranges and it's elevated. Progesterone might be really low, and then we have an absolute finding of estrogen dominance. And then we also have a relative estrogen dominance, which there's so much to talk about, which we will. This is when serum labs don't show it, but there's other reasons why you might have the dominance, which we're gonna talk about each of those.
Mm-hmm.
I don't know if one of you want to dive in with one of them, or I can start on one of the topics.
Yeah, I guess you can start with let's do the absolute.
Yeah. Well, that one is just simply that you
Just
have
the
a serum test
Mm-hmm.
that's showing estrogen dominance. And with that, what we would do is we would support either balancing with our PA here with doing bioidentical hormone replacement therapy. Maybe we need to boost the progesterone a little bit, or we can help with detoxification, looking then at the pathways that help you detoxify those estrogens to help you kind of get it down in a good level. There's lots of reasons why you have an absolute too, like in perimenopause, menopause, you might start having like an anovulatory phase with your period, meaning you didn't produce an egg and it didn't get a follicle, didn't come out. And that can be a reason why you might have a lower progesterone and a higher estrogen. So things are really fluctuating during that perimenopause, menopause time, and estrogens can kind of go up and down and high and low. And so that can be a reason why you might have some absolute estrogen dominance. I would like to say though, that I guess in my experience, this is where I feel like a myth busting time.
Mm-hmm.
Out in the general public, it's really talked about a lot in podcasts and different things, that estrogen dominance, it's estrogen dominance. Well, it's not always estrogen dominance. Sometimes your estrogen is low and it produces the same kind of symptoms. And that's why I'm a fan of testing, because I know I've had early on in my time in training or working with patients and hormones, I would go there and we would start detoxing estrogens and their vasomotor symptoms would start to get worse, or their other symptoms would start to get worse. Well, that's because it was actually not estrogen dominance. They're having symptoms because estrogen was dropping. And so knowing that is key, and kind of understanding the difference between the two, relative and absolute, is important.
Mm-hmm. And then when it comes to relative, that can be more so, things that can act as estrogen too, like xenoestrogens and all that. Again, so might as well jump into testing.
Yeah,
I guess. So when we test, we use usually Dutch tests, so drag your hormone testing, because then it will show us those 3 different pathways our estrogens go down. So then we'll be able to see, is it that 16-OH pathway where we're kind of recycling those estrogens and we need to, push those down a certain pathway, or is it more of the dangerous or less optimal pathway, that 4-OH, that we need to, work on detoxification of our estrogens.
And when it comes to testing different estrogens, can give you different symptoms too. So estrogen 4 and 16 or those pathways, those can be more proliferative. Those are really strong estrogens. Once they bind, it's harder for them to detach if they do detach. And so those give you a lot more of those negative side effects of estrogens that we see, such as like really heavy periods, endometriosis, higher risk of breast cancers, kind of those negative factors that we see. So not only do we look at if you're high in estrogen, but high of what kind,
Right.
Which is important.
Yeah, and that's where the Dutch comes out and it shines, right? Serum testing is one spot in time during your day that you're checking, and it's not going to show those detox pathways. And that's why it's cool to blend the worlds of traditional medicine and functional medicine, because traditional medicine isn't going to look at these pathways. But then you miss out on, hey, your 16-OH pathway that you're detoxing is really elevated, and that's more proliferative. And so there's an example of a relative estrogen dominance, not an absolute. And so then we can do some things to help detoxify, not only detoxify, but also shift you into a healthier pathway of that detoxification. And so that's the cool part. Yeah.
What I really like about how we do testing too is like mixing the Dutch test, and if we're able to, getting a total toxicity test, because then we can see what are the things that are acting as estrogens or binding to those receptors, causing a proliferative reaction. So different types of molds can act as estrogen in the body and cause those issues. They bind to the receptors, and then also pesticides, so like glyphosate, those can act as estrogens as well. And then BPA is another one. I had a male where his BPA was very elevated in his total toxicity tests. And once we worked on that detoxification, testosterone levels went up. So it's very interesting how, what we can really uncover when we can mix total toxicity tests with the Dutch test and just get more information, really.
Because that's just another form of relative estrogen dominance. Is you have a high BPA, but your estrogens look normal, but you're still stimulating those estrogen receptors, like you said. So then we have to find the sources of your BPA, remove it. It's so hard in our world today because it's everywhere. It's in packaging, it's in wrappings, it's just in our water. So then we would work in that pathway, and that's part of that functional medicine route, is looking at the whole picture.
Did we go over symptoms of like estrogen dominance?
No.
Maybe touch on symptoms.
So a lot of the symptoms are really amplified around your menstrual cycle. So really heavy periods, really painful cramps. Often you can get headaches around your menstrual cycle too. That can be high estrogen. Painful breasts around feeling bloated.
Weight gain.
Brain fog.
Weight gain too, especially during perimenopause, we start to have an increase activation, or I don't know if it's an activation or a representation of estrogen receptor alpha, which is a little bit more of a proliferative and inflammatory receptor versus the beta receptors. And even in your fat cells, the white fat starts to get more, and that's where aromatase activity starts to happen. And so when we start to gain that midsection weight gain because of those changes, then we start producing more estrogens because of that too. But we'll see, estrogen, like weight gain and midsection, especially that, the pear-shaped positioning, so around the hips, and then in the midsection too.
And then, what was I going to say? With the breast tenderness issues, sometimes I'll start doing nutrients towards that last phase of the cycle. So maybe like a week leading up to the cycle. And then that makes a huge difference. So a little bit of detox. Let's stay on the call here. A little bit of detoxification using, maybe the IC3 or some other nutrients like broccoli or sulforaphane can make a huge difference in some of those symptoms. And you can usually notice them like pretty fast or decrease of that breast tenderness before the cycle happens. You guys have any other favorites that you like to use? Estrogen detox?
Yes, 16-OH often is sulforaphane that I go to. And then the 4-OH I tend to go towards more like glutathione. And then resveratrol, I believe, can be used for both of them, or some good ones.
TMG is another one that I like for the 4OH.
What is it called?
TMG.
What's that? Oh,
Um,
trimethyl.
Yeah.
Okay.
Yeah. Yeah, and that kind of brings up another point too with that Dutch test. It looks at your ability to methylate or COMT genetics. So sometimes people clear their estrogens too fast. So sometimes we need to kind of like slow it down and, you know, have that estrogen linger longer in the receptors. Some people are just really slow and sluggish COMT, so we need to speed it up so we don't have a buildup of the proliferative estrogen effects. But yeah.
Which takes me to the next relative cause for relative estrogen dominance is gut dysfunction. So we often will do a gut zoomer test to look at bacterial beta glucuronidase. It's made by bad bacteria in the gut, and that prevents good detoxification of the estrogens in the intestinal system and allows for reabsorption of them. And then we'll see some of those levels rise too. So again, pairing that functional medicine, looking at the whole person, is that looking at the gut health is really important for that too.
Because kind of functionally, how estrogen is broken down is that it's broken down in the liver first, and then once it's done in the liver, then it gets put into the intestines and we defecate it out. And so if it's in our intestines for too long and we have to poop, because we
gotta keep pooping.
have to poop every day.
Yeah.
And so if we're not doing that every day, that estrogen can be reabsorbed. And so that just amplifies that. And so we've got to make sure that the gut is working properly. Got to poop every day.
Yes.
It's one of the best things for your hormones.
Anything else that comes to your guys' mind? Kind of hit every piece.
I think some of the myths that I see, I was deep in this on like TikTok and Instagram, like the hormones things.
Yeah.
And I think that so many people market that they can just tell you what's going on with your body based off of symptoms.
Yeah. I've done the tests. I've done the tests, and I've also compared the tests on some of these more common TikTokers.
Yeah.
Did not correlate with my labs at all, but
Yeah.
my results. Yeah.
The symptoms are so confusing. So it's nice because it's like, okay, if I'm having these menstrual pains and all of these symptoms, something with my hormones is off. And that's kind of as far as we can go. And that's as far as someone should go.
Yeah.
And so I really suggest not wasting money and time on these supplements, on these fad diets, and actually just getting to the root cause and know what's going on in your body by getting tested.
Yeah. And I've had multiple like post-menopausal women where we would just expect the estrogens to be too low, right? But then you run a Dutch test on them and we like truly see kind of that relative estrogen dominance going on, even though they stopped cycling. Like we see way too much of that estrogen estrogen toxicity taking place even when they're postmenopausal, so it can still happen.
Yeah, and estrogen dominance can happen in regular reproductive years too.
Yeah.
Which we can touch on. So again, similar symptoms, and we just do the same thing. And there again, we have different herbal supports that have shown to help increase progesterone production, to help balance that out a little bit. So we don't always have to go towards bioidentical hormone replacement therapy. There's definitely other options there for supporting it.
Definitely.
Yep.
Anything else I would need to touch on?
I don't think so. Let me see.
Overall, I feel like if you are feeling hormonally dysfunctional, definitely get tested and figure it out, because it doesn't just go away. The hormones are something they rarely fix themselves. And so it's just going to amplify and get worse.
Yeah. Test don't cast. All right. Anything else you guys?
I don't think so.
Okay, that's
Good.
awesome. Thanks for joining us.
Bye.
That concludes today's episode of Beyond the Superficial. Thank you for joining us, and stay tuned for more episodes. For more information, please visit our website, www.officialsynapse.com, your partners in healthy living for optimal life. We would love to hear from you on how our podcast might be impacting your life. We also want to hear what interests you. Please leave your feedback on our media page at www.officialsynapse.com. Thanks again for listening, and we'll catch you in the next episode.